Hi, my name is Brandy Trepkowski, and I'm a family nurse practitioner with the Rural Health Clinic with McKenzie Health System. I'm going to be talking to you today about breast cancer awareness. This first slide shows us the current CDC cancer death rates, and you can see that female breast cancer is ranked number 2 only to lung and bronchial cancer. Since 1999, though, there has been a decline in actually both the lung and female breast cancers, so that is actually great news. The only cancers that have increased as far as death rates has been pancreatic and liver cancer. About 1 in 8 women will be diagnosed with breast cancer in their lifetime, but on a positive note, that means 7 out of 8 women will never be diagnosed with breast cancer. It is the most common cancer among American women and is the second leading cause of death related to cancer, following lung, like we previously discussed. The American Cancer Society estimates that in 2020, about 276,480 new cases of invasive breast cancer will be diagnosed to women, and about 42,170 will die from it. Since 2007, there have been steady death rates in women less than 50, but we have seen decreased death rates in women greater than 50. And from 2013 to 17, that was about 1.3% decline per year, which is amazing. And this is attributed to early detection and early treatment. People who are mainly at risk for breast cancer include females, those greater than 55, those who have the BRCA gene mutations, either 1 or 2. If you have a family history with having 1 first-degree relative, which will double your risk, and if you have 2 first-degree relatives, that would triple your risk. First-degree relatives would include a parent or a sibling. If you have a personal history of breast cancer yourself, you have an increased risk of developing a new cancer later on, or if you have dense breast tissue. So those are all things that you really can't modify, unfortunately, but on the right side, you'll see all of the things that do place you at risk but are also modifiable. So if you have a diet that's high in fat and associated with a high BMI, especially postmenopausal, that increases your risk. If you overconsume alcohol, mainly because it's usually associated with a poor diet. If you eat a lot of cured foods or processed foods such as charcoal foods, smoked foods, lunch meats, things like that, bacon, for example. If you have a sedentary lifestyle, meaning you're not very active, if you've never had children, if you used hormone replacements, if you never breastfed, or if you're a smoker, you're at increased risk. Just some general anatomy of the breast to show you the difference. Most are ductal breast cancers. So right here you can see it kind of looks like these little lines. Those are the ducts that carry milk to the nipple. And lobular breast cancers start in the glands that make breast milk. There are other types, but they're less common. Current recommendations are every 1 to 2 years for women starting at age 40. Sometimes they may be recommended sooner based on family history. And we estimate that mammograms find cancer 1 to 4 years earlier than clinical breast exam alone. Clinical breast exam would be a breast exam that you would have done in the office by a healthcare provider. There is an increased sensitivity with age, so mammograms actually get better the older you get. And it is the only recommended form of screening currently. Currently, McKenzie offers 3D mammography, and why this is so much better is because it allows for clear images for women who have dense breasts. It uses multiple images to create a 3D image, so it's a lot clearer and it's more accurate to size cancers or questionable areas. It finds more cancers and reduces the number of false positive, and we've seen a reduction in the number of callbacks or extra imaging that's required. And this picture just shows an example of how this questionable cancer is much clearer on the right side versus the 2D imaging. Some symptoms of breast cancer. It's important to note that most people don't have any symptoms, but some, the most common one that I would say is voiced is that they have a painless lump, maybe swelling of part of a breast, dimpling or puckering, nipple retraction, which would be where the nipple is like pulled in, scaliness or thickening of the nipple or skin on the breast, which is a specific type of breast cancer, or lymph nodes in the armpit or along the collarbone becoming swollen. These next slides are going to talk about ways to reduce your risk. So if you remember back a few slides, we talked about things that were modifiable versus non-modifiable. So these are those modifiable risk factors. Unfortunately, we can't change our age or our family history, but there are things that we can do to reduce. The first one is going to be to watch your diet. If you are overweight or have an elevated BMI, you are at an increased risk. The more overweight you are, the more risk there is. Eating a diet high in antioxidants, which is mainly found in fresh fruits and vegetables, can decrease your risks. The superstars of breast cancer prevention are listed. So all those leafy green vegetables, kale, collard greens, spinach, Brussels sprouts, broccoli, cauliflower, carrots, cabbage, and tomatoes are all examples of foods that are high in antioxidants. Exercise regularly. As little as 1 to 3 hours a week may reduce your risk. It's recommended that you exercise 150 minutes per week. That 150 minutes per week is a recommendation for many other groups as well. It's the American Diabetic Association recommends that for activity, as well as the American Heart Association. Exercise can reduce the breast cancer risk by 25% in people who exercise routinely. And this is especially important going into menopause. Not only will it reduce your risk of cancer, but it's also going to help maintain a healthier weight. It's good for your joints, and it's actually good for menopausal symptoms too, including hot flashes. Limit your time spent sitting. Women who sit more than 6 hours per day have about a 10% increased risk. Kind of goes back to those lifestyle factors, and that sitting is associated with a higher BMI. The higher the BMI, the more overweight you are, the more risk that you have. So get up and move around. If you have a job where you have to sit, if you can get a Fitbit or set a timer to go off on your phone, or maybe at the beginning of every hour you get up and take 25 steps or do a hot lap around your desk, anything to increase your activity. Limit your alcohol. If you have as little as 2 to 3 drinks per day, it can increase your risk by as much as 20%. The recommendation is to limit your alcohol consumption in females to 1 drink per day or less, and for men it's 2 drinks per day or less. That does not mean that you get to stock them up. So if you don't use them Monday through Friday, on Saturday or Sunday, it's not okay to have 7 or 8 drinks. That's equivalent to binge drinking, which still increases your risk. Limit hormone replacement therapy. It's not that we don't prescribe it, and it's not that we don't recommend it at times. It's just that we want to use it sparingly, and if it's needed at all, use the smallest amount for the shortest amount of time possible. If you can do it for the shortest amount of time, within 5 years after stopping it, your risk reduces to normal. So obviously risk, increases after age 55, like we talked about. So if you go through menopause at 45 and you're on it between 45 and 50 and you stop it, your risk goes right back to normal risk. It's not, again, that we don't want to use it, and in some women, it's our best treatment option for the symptoms associated with menopause. But if you are able to go through menopause with supportive therapy and not hormone replacement therapy, that would be ideal. By supportive therapy, I mean maybe taking like black cohosh for hot flashes, or maybe something to help you sleep at night. Sometimes antidepressants can help with some of the vasomotor symptoms. Those would decrease or have a neutral risk as far as the breast cancer. At this time, my presentation is concluding, but I would like to offer an opportunity, if anybody has any questions, to email me at the below mentioned email address at my work. Thank you for joining us today.